Questions. The first is, over the last few months, we've seen reports that say that people outside of Black and Hispanic and vulnerable communities have been able to access the vaccines in those communities. In California, there are wealthy residents who are using access codes. In New York, we're seeing that happen. What's the White House's plan for stopping this, and why is it still happening? This has now been happening at least over 2 months.
You're right. I've seen those reports as well, and I think one of the reports I saw was around some of the mass vaccination sites in Oakland and the concerns about whether people in the community were actually getting access to the vaccines as planned. I don't have specific data and numbers, and I can certainly talk to the COVID team, or you can, of course, ask them during one of their 3 briefings about the actual data behind it beyond the anecdotal stories, which alone are certainly concerning. But one of the pieces the president has been talking about and our team has been focused on is the fact that if you don't have internet access, right, if you don't have access to ways to easily sign up to get your vaccine, we need to continue to look for ways to get deep into communities. That's one of the reasons that the president has been so supportive of community health centers that are embedded in communities, know the people in the communities, can make phone calls and do outreach to people they know will need the vaccine. But we also need to continue to find ways to reach people who don't have internet access, who may not have the ability to sign up in a way that others are, and address some of those discrepancies. So it continues to be a big focus, and as you know, we have an entire task force focusing on addressing inequities in how we address COVID, and they're continuing to look for more ways to creatively do that and effectively address problems that are arising as we see them.
Just to clarify, on that point, there's a team that's working specifically on trying to stop wealthy residents or people from outside communities.
I think what I was conveying is, as you know, there is an equity task force that's a part of the COVID team led by Dr. Marcela Nunez-Smith. And obviously reports that individuals who are not from the communities intended to be the primary recipients of the vaccines, if that is certainly something they would focus on and work on issues to address. I would encourage you to ask them about that at the next COVID briefing, though.
And a couple other questions. The first is, you stopped short of saying that President Biden would sign HR 40, the bill to study reparations. I just wonder, now that it's been a few days after the hearing, whether or not there's any update on that, given that the president has said that he would back a study on reparations.
So you certainly would back a study. I don't think anything's changed, though, from what I conveyed a couple of days ago.
You stopped short of saying he would sign the bill.
I said he would support a study, and he certainly would. And we'll take a look if there's legislation that is passed by Congress.